Hi, I'm Dr. Jamie Newman. I'm a hospitalist at Mayo Clinic in Rochester. I'm the chair of hospital optimization and the medical director for the Midwest Admission and Transfer Center. I'm going to talk to you today about an article I wrote for the Mayo Clinic Proceedings called The Heart of the Hospital. Census management and patient flow are essential to the efficiency and function of a hospital for maintaining patient access in times of limited resource. In my article, The Heart of the Hospital, I compare the circulation of the heart to the flow of patients through the hospital. Both are subject to physiology and queuing theory, whether it's the Starling curve or Little's Law. Little's Law relates the number of admissions and the length of stay to the hospital census. Like a heart, the hospital is important to have prevention and treatment when the hospital or the heart is not functioning properly. Understanding the form and the function of the hospital and of the heart are key to this. The heart conducts, it contracts, it ejects, and is subject to preload and afterload. The hospital and the people who work in it, the physicians, nurses, therapists, transportation, all make the hospital function and are subject to working in the facility, whether that's the size and shape of the rooms, the equipment within the hospital, or the imaging equipment, and are subject to admissions and discharge, just as preload and afterload affect the heart function. They can also be measured by the vitals. The vital signs we know well from the heart: blood pressure, pulse rate, but in the hospital it's length of stay and number of admissions that really affect the function of the hospital. Prevention is always important, but sometimes we have to deal with a diseased heart or a diseased hospital. And that in the heart, it may be an arrhythmia. In the hospital, that might be something such as lack of coordination of resources. We also in the heart can see valvular disease in the hospital. That might be a process problem that causes unnecessary work that delays treatment of patients. So in the treatment, we can look again at the preload, the ejection fraction, and the discharge. So for preload, it's the admissions. How can we control admissions? Well, it could be through a transfer center where we don't transfer in patients when we don't have capacity, or it might be putting a social worker in the emergency department to prevent unnecessary admissions. For the ejection fraction, it might be controlling the length of stay with case managers or having census huddles. For discharge, preventing barriers to discharge, or working with the nursing homes to coordinate and improve aftercare. The heart never stops beating, and the hospital doors stay open 24 hours a day. If we monitor the vital signs of the hospital, we can keep the doors open and avoid chronic or acute hospital failure. I hope you enjoy reading the article. Thank you.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.